How did ancient women survive childbirth without doctors? Imagine going into labor thousands of years ago. There is no hospital, no ultrasound, no pain medication, no ambulance, and no modern doctor waiting nearby. There may not even be a clean room or proper medical equipment. Yet somehow, generation after generation of women gave birth, and humanity continued to survive. So how did ancient women actually manage childbirth without modern medicine? The answer is a mixture of experience, community knowledge, traditional practices, and, unfortunately, a lot of danger. For most of human history, childbirth was not treated as something a woman had to face completely alone. It was usually a community event. Experienced women, often mothers, grandmothers, or specialized birth attendants, helped the woman through labor. These women had no medical degrees, but many had witnessed dozens of births. They learned by watching, practicing, remembering, and passing knowledge from one generation to the next. They knew how labor normally progressed, what positions seemed to make birth easier, and when something appeared seriously wrong. One of the most important people in an ancient birth was often the midwife. Midwives existed in many different cultures long before modern hospitals. Their knowledge was practical rather than scientific. They might recognize that labor was progressing normally simply by observing the mother's breathing, movements, pain, and contractions. They could also recognize certain warning signs. Of course, their understanding of the human body was limited, and they could not perform many of the emergency procedures that modern medicine can provide. During labor, ancient women also had something that modern childbirth sometimes lacks: familiar surroundings and constant community support. Instead of lying alone on a hospital bed, a woman might give birth inside her home, surrounded by other women she trusted. She could walk, squat, kneel, sit, or change positions as she tried to find a more comfortable way to handle the contractions. In many societies, upright positions were common because gravity could help the baby move downward. But childbirth was still extremely dangerous. One of the biggest threats was heavy bleeding after delivery. Today, doctors have medications, blood transfusions, surgery, and other emergency treatments that can save a mother's life. Ancient communities had none of these options. They sometimes used pressure, herbs, cloth, or traditional remedies, but these methods could not reliably stop severe bleeding. When hemorrhage became extreme, there might be nothing anyone could do. Another major danger was obstructed labor. Sometimes a baby's position or the mother's anatomy could make a vaginal birth extremely difficult or impossible. Modern medicine can respond with an emergency cesarean section. Ancient women did not have safe surgical options. Attempts at surgery were rare, extremely dangerous, and often fatal because there were no antibiotics, anesthesia systems, sterile operating rooms, or modern surgical techniques. In many cases, an impossible labor could become a tragedy for both mother and child.
Infections were another silent killer. Ancient people did not understand bacteria or viruses, and they could not see the microscopic organisms entering a wound. Birth could involve blood, tissue damage, and sometimes tears, creating opportunities for infection. People might clean themselves and use plants or substances believed to have healing properties, but there was no reliable understanding of germs. Something that looked clean could still carry dangerous microorganisms. Pain was another part of childbirth that ancient women had to face without modern anesthesia or epidurals. Different cultures developed different ways of coping. Women might use breathing, movement, massage, warm water, physical support, prayers, chanting, or herbal preparations. Some traditions included rituals intended to protect the mother and baby from supernatural forces. Whether these rituals had a medical effect or not, they could provide emotional comfort and help the woman feel that she was not facing the experience alone. Ancient societies also developed surprisingly detailed knowledge about pregnancy and birth. They observed patterns. They noticed that certain foods affected the body, that pregnancy followed a predictable period, and that babies usually emerged in particular ways. Some cultures recorded medical knowledge about pregnancy and childbirth in ancient texts, but this knowledge was mixed with beliefs that modern science would consider inaccurate. People could understand practical observations without understanding the biological reasons behind them. And there is an important misconception we should avoid. Ancient women were not necessarily tougher than modern women. They were human beings with the same basic biology, pain responses, fears, and physical limitations. The difference was their environment. They grew up in societies where childbirth was a familiar part of life. Girls often saw relatives become pregnant and give birth. Women who assisted births gained experience over many years. This created a kind of community memory about childbirth. Still, surviving childbirth was partly a matter of luck. A woman could do everything right and still die because of a complication that modern medicine could treat in minutes. This is why childbirth was historically one of the most dangerous events in a woman's life. The fact that humans survived does not mean ancient childbirth was safe. It means enough mothers and babies survived for communities to continue, while countless others did not. Over thousands of years, people slowly improved their understanding. Midwifery traditions became more organized, medical knowledge expanded, surgical techniques developed. Later came anesthesia, antiseptic practices, blood transfusions, safer cesarean sections, fetal monitoring, and modern emergency obstetric care. Each development reduced risks that ancient women had simply been forced to accept.
So when we ask, how did ancient women survive childbirth without doctors, the answer is not that they had some secret ability that modern women have lost. They survived through preparation, experienced birth attendants, family and community support, traditional knowledge, physical adaptability, and sometimes pure chance. But many women did not survive. That is one of the most important truths hidden behind the romantic image of childbirth in the ancient world. The next time you see a modern maternity ward with trained medical staff, sterile equipment, emergency surgery, medications, and machines monitoring a mother and baby, remember how extraordinary that environment really is. For most of human history, none of those things existed. A woman gave birth surrounded by people who cared about her, using everything their society knew. Sometimes everything went well, sometimes it didn't. And perhaps that is the most remarkable part of the story. Humanity did not reach the modern world because childbirth was easy. Humanity reached it because countless generations of mothers endured one of the most difficult and dangerous experiences of human life, and because every generation slowly learned a little more about how to make the next birth safer. Thank you very much for watching the video.